Everybody, thanks so much for listening. If you are listening to us on one of the podcasting sites, we thank you so much. Please like, subscribe, share. If you are listening to us on one of the radio stations, the 25 radio stations that are broadcasting this show, we greatly appreciate that as well. Again, keep listening, keep subscribing, keep liking, and keep sharing this program, whatever you're listening to us on. So we have a very great guest today, New York Times bestseller, USA Today bestseller, Lies I Taught in Medical School, Dr. Robert Lufkin. Doc, it's a pleasure to have you on from one Rob to another. Thank you for coming on.
Hey, Rob, it's a pleasure to be on your show today. I'm really looking forward to it.
So, what the hell has happened in the medical institutions in our country, but not just to mention our country, around the world since 2020?
Yeah, I think in the 20th century, the medical system had a whole series of wins. Basically, our healthcare system transformed the lives of pretty much all of us through the pills and surgeries that were developed largely through public health measures, infectious disease, but really the world was a much, much better place because of what the medical system did. Then fast forward to the 21st century, and in the 21st century, a little before 2020, but about that time frame, literally a tsunami of what are called chronic diseases have occurred. And these are diseases that were present in the 20th century, but nowhere near the numbers now. They are in biblical numbers now in the 21st century. And these are things, to be clear, all the way from obesity to hypertension, diabetes, heart disease, stroke, cancer, Alzheimer's disease, and even mental illness. And the problem is, when the healthcare system takes the same pills and surgeries that were so transforming and life-saving in the 20th century and applies them to these chronic diseases, while in most cases, they will treat the symptoms and may even be life-saving in the moment, they don't really address the root cause, and these diseases continue to progress on. So what we have is a situation where the symptoms are treated, and the patient may even feel better and think they have things under control, but they're actually getting worse. And that is the problem. And that's what I talk about in my book. And I think this is a huge issue that's getting worse all the time. And I mean, today, most people have at least one of those chronic diseases, and many people have multiple ones of them.
Yeah. And I do want to get into that. But since we're starting at 2020, let's continue on to 2021. I played soccer in college, worked out my whole life, and I have to be very careful how I say this because this will not be censored on radio, but it will be censored if I say the wrong words on YouTube and Spotify. So we have to be very delicate with explaining this, Doc. In 2021, I received the medication that many people around the country and around the world did get due to what happened during the pandemic. They thought they were being safe by doing this. A lot of people had no adverse reactions to that medication. Unfortunately, I did. I'm still suffering from adverse reactions from the medication that was distributed throughout 2021 and even beyond now. So, and I went through to many doctors, every doctor you can think of, due to my adverse reaction, and they would not admit that it was from the medication that, and I have to be very careful how I word this. The medication I received through a pharmacist, it was injected inside of me in 2021. Before 2021, Doc, I believed everything the doctor told me like they were Jesus Christ on earth. I listened to them. I thought they were smarter than everyone. And I've met a lot of good doctors through my journey in the past 3 years because of my reaction. I've met a lot of losers the past 3 years, people that wanted to put me on depression medication, anxiety medication. This is something where I believe you discuss in your book, where these doctors are not looking for the root cause of what happened to me and many other people around the country and around the world. And whether it's due to the medical issue I had or due to obesity or due to heart issues, whatever it may be. They are looking to push pills on people. They are not looking for that root cause. So this again goes back to your book. So there's been a lot of medical trauma for me through the past 3 years. There's been a lot of fighting with doctors. I've had doctors laugh in my face. I don't want to make this all about me. The audience knows a lot about these stories because I've discussed this on air. But again, how do we kind of siphon through these doctors and get a good doctor? Because it's very tough to find out there, Doc, because if you try to get any specialist or any doctor that's halfway decent, you got to wait months. I was looking at a doctor's appointment the other day for a neuro optometrist, and they told me that they want me to wait until April for this. All right. We are in November taping this. So sorry to get a little agitated, but I think myself and people listening are agitated about what's going on with they can't find a good doctor. And if they find the doctor they need, they got to wait months and months. And the problem obviously will consistently get worse. Sorry for the ramble.
No, I think access to healthcare in many locations is a problem, but I think it goes deeper than that, because if the healthcare we get is incorrect or misses out on the root cause, then getting access to that doctor in 1 month instead of 6 months isn't really going to help anything. And that's the sort of broader message of this book, that we need to rethink the mechanisms of these diseases, that they, in my opinion, and it's not just my idea, I show what I believe is convincing peer-reviewed evidence in the book, that all the diseases I mentioned share a common root cause that is addressed with the common things that we can do. That just because the pills and surgery don't work doesn't mean there's nothing we can do. There is, and the answer is lifestyle. And that will work where no pills and surgery will work.
Why do most doctors, Doc, they'll push the pills or the surgeries and they don't look like you're talking about into the root cause? What are you doing? Are you working out? Are you eating healthy? What kind of food are you eating? Are you watching stressful things on TV? Do you have a lot of anxiety and depression in your life? No doctors talk to their patients like that. Or I should say very few. That's a generalization. But most doctors, I go into the doctor's office, they go right to the computer and start typing. They don't even look at you in the face, eye to eye.
Yeah, I think the problem, you're hitting on it. And first of all, let me say, in my heart of heart, I don't believe that medical professionals or most people get up with the intention of doing harm to someone else. But I think, built into our system, there are conscious and unconscious, pernicious financial and other incentives that drive things the way they are. I mean, part of it is going to a doctor's office, and, in many cases, the doctor's visit is 7 minutes, and you really can't get into a deep discussion on that. And furthermore, if I go into a doctor's office, I admit I would rather take a pill or even surgery than have a doctor lecture me about my lifestyle and what I need to eat and diet and something like that. So we all want the easy way out. But the message here is there is no easy way out. The pills and surgeries are not always, and in many cases, I believe, not really the solution. They may help us, with the symptoms, but we need to address the underlying root cause. And that's not what's being done in most cases today. And that's why we have this literally tidal wave of diseases that are, by some estimates, taking up 80% of our healthcare resources now.
Well, even just look at the military. They're not even recruiting enough men and women to go into the military now. This is a national defense issue where we can't fight wars. We can't even defend our country in general because we have a bunch of people in this country that have either health issues or obesity issues where they can't, participate in the military, whether they want to or not. Let's talk about obesity. The food is horrendous in our country. Half of the grocery store is packaged garbage. And people just constantly thrive on snacks and stuff that they think is good. You know, you look at the ingredients in any kind of box food, and half of the words you can't even pronounce the damn things. So, what is the issue here? When did this start? How can we change this? Because it's getting worse and worse on time. And again, I'll just put the exclamation point on this. I like this guy. Some people listening don't like this guy. Some people listening do like this guy. Robert F. Kennedy Jr., whether we agree with him on the vaccine issue or on other issues, that's another story for another day. The man is talking about health and what's in our food and what's in our water, and it's hurting people. And we need people in politics because they're all getting money for the big pharma, and they refuse to stand up and fight against the obesity epidemic, against pushing pills. We saw this in the opioid epidemic. And people are not fighting for health in our country. They're just fighting for the money.
Absolutely. I mean, this all started in, we could trace the rise in these diseases around the 1980s, 1990s, and they just took off. A couple things happened then. One, the tobacco industry, which are really masters at advertising and marketing. You know, they could place cigarettes at 7-Elevens and checkout lanes and, you know, package them a certain way. The only thing they couldn't do was sell to children because there were laws against that. Well, in the 1980s, the tobacco industry, several of the large companies could see the writing on the wall that their growth was limited due to legislation about cigarettes, and people realized how bad tobacco was. So interestingly, they pivoted and they went into the junk food business, and they bought large junk food makers, and suddenly they began marketing junk food with the same skill they did with cigarettes. Now 7-Elevens and gas stations are full of junk food, brightly colored packages, with one key difference though. Because they can now market to children, there are no laws against selling unhealthy junk food to children. So now you have bright packages with cartoon characters and sports celebrities and other people on them that are, you know, selling things to you and me. So there are a number of things that started in that. But, you know, to your point about the military, there's a food pyramid that was developed by the USDA and is constantly updated. It's a pyramid like this. We've probably all seen it, with the bottom row you're supposed to eat the most of, and the top you're supposed to eat the least of. And the problem is Nina Teicholz and other investigators have recently disclosed that the most recent USDA committee that reformulated the food pyramid, 95% of the people on the committee had conflicts with the food industry. They were basically working for the junk food industry. And so this food pyramid, if you look at the bottom row, what you're supposed to eat most of, it's junk food, it's cereals, it's grains, it's, you know, baked goods, stuff like that. And you think, well, that's just the food pyramid. Who cares? Well, no, the food pyramid, even though it's a U.S. institution or product, first of all, it influences meals, the way our kids are fed, meals based on the food pyramid. Our military our veterans are fed food based on that. Hospitals and all over the world, people follow that food pyramid. So it really matters. So these institutions have become corrupted.
And we also see this, to be fair to the audience, with HHS and CDC, that they circle from big pharma to HHS and CDC, FDA. We saw this during the COVID crisis with, you know, the approvals of the medication that I can't speak about. And it's really disgusting in our country that there are not laws, not just about the medical industrial complex, but also what's going on, as you stated very correctly, Doc, with big food, because it is a crisis. And it seems like, you know, again, the politicians don't give a crap about what's going on in the country with as far as health goes, but they worry about lining their own pockets. And again, we see this with CDC, HHS, and obviously the big pharma companies all the time. I want to get into this, Doc. Again, for people listening that are just tuning in, Dr. Robert Lufkin here on Fire Breathing Rob. Go to drrobertlufkin.com. I want to spell that out for people listening. It is Robert, Robert, KINMD.com. And definitely check out the website. A lot of good information on there. And this is a man that is actually telling the truth about what the heck is going on with this medical system in this country.
You
He
can
also
actually
has a
yeah, you can actually download a free chapter of the book, the first chapter in audio and PDF if you'd like.
right,
There.
and you can get the book. Go on Amazon, get the book. New York Times bestseller, USA Today bestseller. Lies I Taught in Medical School. He has a podcast there. We're going to get a little bit into that as the interview goes on. Doc, I want to talk about this and get into the book a little bit because I've ranted and raved enough for today. So let's hear what you got to say about the book and how that came about. So talk about how the book came about.
Yeah, it's a great question. My background, people come at this from very different places. I'm coming at this, my background is I'm actually part of the problem. I've spent my entire career as a medical school professor, and I still am. Last time I checked, at least I haven't been fired yet. And I basically, as a professor, I get to practice medicine. I get to teach, and oftentimes is not learn from medical students and other people that I interact with. And then finally, I also do research. I've written over 200 peer-reviewed scientific papers. My lab has received literally millions of dollars in grants from drug companies and big pharma and device makers, and even the federal government, places like NIH and all, to do research. So I am part of the problem, and I was doing fine, just doing my job, not really questioning things. And then what changed me was I came down with 4 of those chronic diseases in a very short period of time. I went to my doctors and I said, wow, what gives, And they said, oh, that's okay. Don't worry about it. Here's a prescription. They gave me 4 prescriptions for each one of those diseases. And I'm saying, whoa, well, what about lifestyle? Does that work? And they go, nah, it doesn't really work. You're going to be on these pills for the rest of your life. So get used to it. And at that point, I mean, I had two young daughters in elementary school, and I knew this wasn't going to end well, knowing what I knew. So I began studying and diving deep in the literature, and I realized there's been a revolution of our knowledge that I wasn't aware of, and most of my colleagues, sadly, are still not aware of, about how these chronic diseases are driven by a root cause which doesn't respond to pills or surgery in most cases, but can be addressed with something even more powerful than pills or surgery, the most powerful medicine that most of us will ever take, and that's the lifestyle choices we make. And it transformed my life, and now I've made it my mission to get this message out with this book and help other people take back their health and not make the same mistakes I did.
So what are those lifestyle choices? I mean, we've talked a little bit about eating healthy, working out. What else would you tell people to look into?
Yeah, I mean the basic one is nutrition, and we can dive into that if we want, but and nutrition is foundational because it's the medicine that most people on earth take every single day. But it's not all medicine. In fact, even if a person does all the right things with their diet and has a perfect diet, if the other pillars or other legs on the stool aren't correct, your metabolic health will fall apart, and you'll still be at risk for these diseases. And these things include such things as sleep. I didn't think sleep was a big deal. I'm a doctor. I carried around a pager. I was on call 24/7. All the time. I got called in the middle of the night. I thought I was tough. I thought I was helping my patients, and I realized I was actually stupid, and I was potentially harming my patients, and I was certainly harming myself by not getting the right amount of sleep and just being very cavalier about it. And you think, wow, how is sleep affecting your metabolic health, this basic root cause? Well, there are a number of studies, one I quote in the book, about a bunch of healthy college students. You start sleep depriving them, and in a matter of days, they will all develop, or a large number will develop, type 2 diabetes, and which is a metabolically unhealthy situation. So sleep is important. And then it's not only quality, but quantity of sleep. Both of those are key. In addition to sleep, and nutrition, two other things. One is exercise, both physical and mental exercise. And then finally, stress. And this is a complex thing. It's like stress, sense of purpose. Why am I here in the world? What do I live for? Is the world a loving, grateful place, or is the world a dangerous, harmful place that's going to kill me and take me out? And the interesting thing about stress is, and stress is one of the biggest drivers. Chronic stress drives chronic inflammation. It drives all these chronic diseases. And the interesting thing about stress is that I wasn't aware of this before, but stress is not a result of what happens to me in my life. Rather, the stress that I experience is a result of the meaning that I assign to whatever happens to me in my life. In other words, I could have a very painful surgical operation that was extremely stressful, and I'm scared, it's cancer, blah, 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 versus another person could have literally almost the same pain with a surgical operation, but it would be a joyous event because they're having a C-section for the birth of their child. So it's all about how we frame things in the context. And I think stress and sense of purpose is one of the most powerful, important factors in this whole thing of metabolic disease.
And thank you for explaining that. I think it's very important because, again, there's a lot of people that don't have that knowledge. Again, that's why we hope you go to robertlufkinmd.com. Look at the book there, Lies I Taught in Medical School, because he can lead you down a better path and try to hopefully get your health in order. Obviously, it's not Dr. Lufkin's responsibility for that. He can give you the tools. You got to step in and do it yourself as far as that goes. So it's just a lot of willpower and a lot of, easy things, honestly, to do to move forward in life. I want to end the interview with this. When people read the book and obviously listen to this interview, what do you hope they learn most?
Yeah, well, one thing was a wake-up call for me. I'm a doctor, but I now realize that doctors don't make me healthy. In other words, I go to a doctor, they'll make me less sick. If I want to be healthy, I'm in charge of my own health. And the way I do that is through lifestyle. And the empowering thing about lifestyle, and I think this is a new era in medicine, is that all of us as patients, we take control of our health. We are the CEOs of our own health. So that is fine. We listen to our doctors, we take their advice or not, but ultimately, the decision about how we live our lives, in particular the lifestyle, we have agency. Every single morning I can get up and I decide what I'm going to eat, when I'm going to eat, am I going to exercise, even how I look at the world, my viewpoint, my view of stress and everything. And that's very, very empowering that we are in charge, and it's the most powerful medicine or surgery that most of us will ever experience.
And people can go to, again, www.robertlufkinmd.com. Get the book there. Again, Lies I Taught in Medical School. And we do hope people look at the podcast as well on there. Talk a little bit about the podcast as we come to a close, where people can hear it, find it, follow you on social media as well. Give us all that before we end the conversation.
Yeah, sure. Well, the social media, on my website, you can find all my social media links. I'm active on Twitter, X, Instagram, LinkedIn, Facebook, Threads, even Twitch.
Wow, you're all over the place.
And our podcast is it goes out once a week on Tuesday. We broadcast it on the usual audio links, Spotify, iTunes, and all. But we also broadcast it live streaming on Tuesdays and Thursdays to YouTube, LinkedIn, Facebook, Twitch, and X as well. And we cover topics of interest. It's called the Health Longevity Secret Show. So we talk about being healthy, what we can do to improve our metabolic health. We look at some new new treatments, red light therapy, versus even new pills like GLP-1 agonists for weight loss and even more things. We look at metformin, rapamycin. It's for a general audience. We sometimes we get technical, but we always try and keep it so that people can understand it that way.
Again, we do hope people go and follow Dr. Lufkin on every platform that you're on. Of course, it's too many to name. Again, go to the website, robertlufkinmd.com, and definitely get the book, Lies I Taught in Medical School. It was something that's on the Christmas list for people, not just myself, but for other people. Definitely go and get that for your significant other, your family member, whoever the heck it is. But Doc, thanks so much for coming on. I hope this is not the last time. I hope my rant at the beginning didn't scare you away. There's so much valuable information you can bring to the conversation today, and we hope this isn't the last conversation you have with the program.
Thanks, Rob. I really appreciate your questions and conversation and look forward to